When I'm finding things difficult, how do I know it's burnout? Once I'm in burnout, how do I get out of it? Is there any way we can avoid burnout altogether? 3 of the most common questions I get asked as an autistic writer, and with good reason. For something which does so much lasting damage, burnout is something we really don't talk about enough. All right, Nyota? If you've looked for help with burnout and not found the answers you need, then you've got plenty of company. I've been there myself and got equally caught up in the swamp of generic advice being repeated over and over again by one self-help expert after another. To burn out is to crumble under the pressures of modern life to the point where we can no longer cope, and without help we may not get through it. It's something which hasn't really been researched as well as it should have been, because like many issues with our mental health, it's historically been brushed under the carpet. Men especially, though far from exclusively, have found all sorts of euphemisms and social rituals that vilify and exclude anyone who fails to keep up, and make jokes about anyone else who shows signs of faltering. But burnout is chillingly real, and if ignored or mistreated, it spirals into a feedback loop of self-doubt and loss that rarely ends well. I'm Quinn, and the reason I'm so intimately acquainted with burnout is I'm autistic. Pretty much everyone's heard the phrase autistic burnout these days. But if you think an autistic burnout is some kind of exotic variety of meltdown, you'd be mistaken. The symptoms of autistic burnout are exactly the same as the kind of burnout that a busy executive, an exhausted doctor, or a factory worker on their 3rd week of double shifts might experience. The details, causes and sensitivities may be different, but the suffering and the incapacity they cause, and the basic approach to fixing them, are very similar. I've bought tickets on the burnout bus more times in my life than I care to mention. The shortest time between total burnouts for me was just under a year. Even by autistic standards, I've been through some rough times and had to find my own way out because there was nobody else to help me. But I haven't burned out for over 10 years now. I've got very close to it a number of times, but I've not slipped over the edge into the abyss. My last actual burnout was in my 40s, and I'm 55 now. I found a formula that works for me, and it's taken me a good decade and years of making videos like these to finally find a way of explaining it that can help someone else. So, why not get yourself a cup of something refreshing and tasty, find a comfy spot to sit down, and join me to start a conversation on how any of us can learn to be a burnout badass. In the opening sequence of legendary 1970s sitcom The Fall and Rise of Reginald Perrin, the titular character strips off his suit and strides into the sea, faking his own demise in a desperate attempt to escape his living nightmare. Around 7 million people, nearly a quarter of all UK adults, watched that first series in 1976. And in the canteen conversations the following days, nobody could agree on Reggie's struggles being a nervous breakdown, a midlife crisis, or just a failure of his stiff upper lip. We just didn't talk about mental health back then. You were either normal or a nutcase. The idea of treating mental health conditions as illnesses requiring treatment rather than fey weaknesses we needed to snap out of was still in its infancy, and its treatment a crude work in progress. We didn't even have names for half of the mental illnesses, neurodivergences, learning disabilities and personality traits that we do now. But those unidentified struggles was still going on unseen. Reggie Perrin's overwhelming sense of frustration and consternation at the inevitable grind of his 1970s life, from abrasive presence towards a pulverising future, was a very good candidate for what we now recognise as burnout. I know it all too well, because in my 50-odd years I've burned out way more than anyone deserves, and every time the struggle to get back on top of things and stay afloat seemed to get harder, not easier. I'm open about my difficulty in handling certain aspects of the modern world. I'm a maker and a fixer, not a talker or influencer, as ironic as that may sound coming from here. And that specialised skill set has been as much of an obstacle to me in life as it's been an asset. Whatever hard lessons I learned or precautions I took after each recovery from burnout, I'd always miss something, and eventually the cycle would repeat. Things would unravel again and I'd be back riding the burnout bus. But I eventually broke out of that spiral around 10 years ago, and it's taken me until now to not only find the right words to explain how I did it to someone else, but also to feel confident I actually have beaten it and actually have something worth offering. BADASS isn't just a catchy title. It's an acronym for the stages I took to beat burnout. A system, I guess. It's what helped lift me out of burnout the last couple of times it happened to me, and what's kept me out of burnout ever since. The first part of the system, the BAD, B-A-D bit, is about identifying burnout in the first place, because it's not always as easy as it sounds. Let's start off with the clinical take on burnout. In 2019, in the 11th edition of its ICD manual, the World Health Organization said that burnout features included feelings of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. They also said that at the time it wasn't to be treated as a medical condition, but an occupational phenomenon. Nowadays, there's some will towards including it in the next editions of the ICD and the DSM as a distinct medical diagnosis, but at the moment it's classified as just something that happens to people who push themselves too hard at work. Yep, that's right. According to the experts, we can only get burned out at work. So all you struggling disabled folks, stay-at-home parents, unpaid carers, unemployed, and anyone else who can't or doesn't have to work can just sling your hooks as far as the WHO are concerned. They tell us several times in their definitions that burnout is something that only happens at work, or at a push, in education. If you experience any of the same issues in any other walk of life, well, you'll just have to call it something else, won't you? Except there isn't a better word, not in English anyway, or a defined condition that quite meets the description of the total mental and emotional exhaustion so many people are struggling with every single day, regardless of their age, location, or employment status. Shortly after ICD-11 was published, a 2020 paper came up with a set of conditions for diagnosing autistic burnout. And since I'm autistic, these are the ones we'll work with today. But whilst that definition is specific to autistic people, it still serves as a good template for any kind of burnout from life rather than just work. Dora Raymaker and colleagues described autistic burnout as being a syndrome that's identified by pervasive features, long term. They say 90 days or more typically. It means that if the low feeling lasts only a few days or a couple of weeks, it's not that we're okay, but we're not burned out. Yet. But when we do, there'll be pervasive feelings of physical and mental exhaustion, loss of functional skills, and a reduction in our tolerance to sensory stimuli. It's brought about by a mismatch between the expectations of others, and often ourselves, not being matched by our abilities to meet them, and getting very little support to fill in the gaps. They emphasise that autistic burnout impacts all areas of our daily lives, not just those related to work, so it's to be considered a distinct and separate diagnosis to occupational burnout. If I go to my GP complaining of exhaustion, loss of motivation and the disconnected feeling that I really don't matter, so why am I bothering? I'll likely come out with a diagnosis, most likely of depression, and a month-long prescription. Because if we're burned out, it's very likely we are anxious or depressed at the same time. That prescription is literally just what the doctor ordered and will probably make us feel better. But if it is burnout, that won't be the end of it. If our exhaustion, our withdrawal, our desperation at being unable to find a way out isn't just a temporary imbalance in our brain chemistry, or it's more than a reaction to unusually traumatic events in our lives, if the same problems that sent us to the doctor in the first place are still there when we finish taking the pills, or got even worse, we will burn out again, and we will be back for more pills later. Nothing I say is medical advice. I'm not qualified to give it. Don't stop taking your medication or cancel your appointments because you've just realised you're burned out. If your mood is low enough that your doctor prescribes you treatment and it makes you feel better, then it's not a bad thing. But it's only going to be temporary relief if we don't find a way out of whatever it was that burned us out in the first place. Don't see the relief we get from the medication as just a time to heal. It's an opportunity to fix things. The first step in becoming a burnout badass is knowing how to identify burnout as distinct from the anxiety and depression that often go with it. That's what the BAD stands for. Burnout, anxiety, or depression. Depression is a persistent feeling of low mood and hopelessness that can be caused by a number of different factors in our lives, but the treatment all follows much the same principles regardless. If I go to a UK doctor complaining of symptoms that sound like depression, then they'd want to offer me either talking therapies, medication, or both if my situation warranted it. In an ideal world, they'd not prescribe me any antidepressant meds at all and would send me straight to therapy for assessment, but that's somebody else's timeline. Therapy waiting lists are months or even years long in some UK locations, so with the option to talk to someone practically unavailable, GPs have to triage instead. It's inhuman to expect someone to continue suffering for months or years waiting for help when there are easily available meds that might make things easier in the meantime. It's common for people who are diagnosed with depression to exhibit anxiety as well, but it's also common as a separate diagnosis and as a long-term psychiatric condition. Some people, autistic or not, are prone to overly anxious feelings no matter what their circumstances and are classed as having an anxiety disorder. Not so long ago, we'd have just dismissed them all as worry words and told them to pull themselves together. But we now know that some people's brain chemistry is permanently predisposed to worry and caution, and there are therapies and treatments that can help alleviate it if desired. To be anxious is to be intensely worried about change, but especially about failure, usually our own, but sometimes it's the potential failure of something or someone we care about that has us troubled. We feel like the odds are against us, and we lack confidence in our ability to succeed. It's the polar opposite of bravado. When anxiety gets to the point that it clouds our decisions, impacts our memories, or affects our health, sleep, or appetite, then we have cause to see the doctor and ask for help. If anxiety could be summed up in a single thought, it might be something like, I don't know if I have what it takes to get through this. Anxiety is expected when we've suffered repeated setbacks and have reason to fear we'll fail again. Each failure has chipped away at our confidence in our abilities, especially if we blame ourselves for those failures. We've not given up yet, but we're afraid we might have to. Anxiety can be triggered by a single event or dilemma, or it can build up over time, but it's characterised by pervasive doubts. Whether it's about ourselves or the people we trust, anxiety is our fear of being let down or of failing and all its consequences. Applying the same single thought idea to depression as we did for anxiety just now, depression might be, I can't win, so why am I even trying to get through this? Depression comes once we've lost belief in our ability and start to feel that failure is inevitable or already here. So what's the point in carrying on? Anxiety risks exhausting us through exertion, but depression sucks our energy away. Exhaustion is the starting point, physically, mentally, emotionally. That get up and go we were struggling to hold on to when we were just anxious has most definitely got up, packed its bags and hasn't even sent us a postcard. Even the basics of everyday survival feel mountainous when we're depressed, and our executive functions can hit an all-time low. However, even if we've given up on meeting other people's expectations, we may still be obliged to be seen to attempt to meet them, so anxiety can exist alongside depression. Anyone heading towards burnout is undoubtedly feeling anxious, and when we have burned out, the symptoms are remarkably similar to those of depression and respond to the same treatments. So why the need to know the difference? Anxiety and depression in isolation are very well known, understood well by doctors and familiar to the public, and they do respond well to readily available, cheap, generic drugs. The most commonly prescribed medications for both conditions in the UK are SSRIs. Selective serotonin reuptake inhibitors, which work on the biological mechanisms underlying both diagnoses. Drugs like fluoxetine or sertraline, for example. When we're anxious or depressed, the levels of the neurotransmitter serotonin in our brains are lower than normal, so the drugs make sure that the serotonin we do produce stays in our system longer, keeping our mood better. When we're depressed, the meds lift our mood up from where we were before and helps to boost our energy levels a bit, making us both a little happier and better equipped to deal with life. The lower doses prescribed for anxiety take the edge off things, for me at least. They make me care less about failure and not so inclined to worry about things, and because worry is itself a hindrance, life gets a little easier to cope with. If the problem causing my anxiety can be easily dealt with or is time limited, it might be enough to keep me away from depression's door. Ironically though, in the small print of every antidepressant, in the sections covering possible side effects, you'll always find anxiety, depression, and usually a few other mental health conditions listed alongside the usual headaches and nausea. Yep, in a cruel twist of fate, the very medications our doctors might in all good faith prescribe us to alleviate our anxiety and depression could potentially make them much worse, however rare it might be. But those aren't the only causes of either though. Lots of other meds list them as side effects too, and as we know, some of us are permanently disposed to high levels of anxiety in our daily lives. Is there anyone who hasn't heard of bipolar disorder these days? We used to call that manic depression because folks alternated between days, weeks or months of intense excitement, engagement and activity we call manic periods and equally protracted stints of depression. Injury can cause depression, as can disability, illness or infection. Pregnancy is an anxious time for many women, and postpartum depression can be a tragedy for mother, child and everyone who cares about them. Not to mention, there just may be a very good, relatable reason for why your anxiety is higher than normal or that you're feeling sad, lost and hopeless. Burnout is the main reason I wish talking therapies were more available than they are. Because burnout needs more than pills to overcome. But you need more than a GP to identify burnout. Antidepressants can help us smooth out the creases, but when they run out, the creases will start tripping us up again. Talking to someone with the right training or understanding can make all the difference. With the best will in the world, there aren't many GPs who can reliably do that, so they do the best they can. They give us a prescription and a place on the waiting list. The kinds of anxiety and depression that can be put right with a GP's prescription are often triggered by something temporary or unusual. It's the consequence of something we wouldn't encounter on a regular basis, so the prescription that helps us not to care so much gets us through the worst of it until it's over. Time is the great healer, as the saying goes, and a great deal of frontline medicine embraces the passage of time as a component. Time is woven into every medical procedure or treatment, including psychiatry and counselling. Most things that are aggravating enough to make us conspicuously anxious or sufficiently traumatic to cast us into depression aren't the kind of troubles we encounter every day. And once they pass, and we've got some distance from them, everything gets easier. But burnout isn't caused by rare one-off traumas or our brain chemistry being off kilter thanks to an injury or infection. Burnout is built upon repeated, ceaseless real-world stresses that stack up over time until we collapse under the weight. It might be a nasty shock that tipped us into the darkness, but it was the steady build-up of repeated frustrations, failures and indignities that brought us to the edge of the pit. It's not an overreaction to something we'd normally take in our stride, or an understandable reaction to a nasty surprise. It's the culmination of months or years of persistent, unending, mind-melting stress. When we try to sum up burnout in a single sentence like we did for anxiety and depression, it sounds a little different to those. For all its horrors, there actually exists a kernel of optimism in burnout. I can't cope now, but I might be able to cope if things were different. We often feel anxiety on the way to burnout, and it's likely we'll feel depression once we get there, and both need addressing and maybe treatment. But we have to work on the underlying problems causing our stress if we don't want to burn out again. And that's why talking to someone can make all the difference, if there's someone to talk to who can understand. Any counsellor or therapist is going to ask us about what we believe is causing the problems we're having with feeling or thinking properly, and try to help us work it through. Like a detective piecing together a case with the patient, us, as both the victim and the star witness. They help us dig through our past and our present to trace the roots of our problems, then either help us put them into perspective or point us towards constructive solutions. It may still involve a prescription, but also a plan to fix the causes of our woes too. Most GPs provide whatever help they can from their surgeries and refer us on to the experts to do the rest. Except many of us never get as far as the expert help. The wait is often so long that we eventually feel well enough to wean ourselves off the pills, and by that time whatever was stressing us has blown over or stopped hurting so much. Wounds heal, relationships reconcile, and new opportunities arise whilst we've been shielded from the worst of the pain by our prescriptions. But when it's burnout, that time might never come, or it's very brief when it does. We've had a few months of not worrying about things so much, and we feel like we've recovered enough to face the world again. We've got our strength back. But if nothing's changed whilst we've been getting help, that strength will soon be eroded, and we'll end up back in the same place again. Up until this point, everything I've talked about applies pretty much equally to everyone. We're still in the territory of the depression, anxiety and burnout that any of us can struggle with. If you're not autistic or neurodivergent, then everything we've talked about so far applies to you as much as to me. But that's about to change. We're about to take the leap from the kind of burnout anyone can suffer, including autistic people, to the realms of the purely autistic burnout. Let's say I go to the doctor right now asking for help with burnout.
Now, sit down, Quinn. Now, what can I help you with today?
I'm not coping well lately, Doctor. I'm finding it really hard to get interested in anything lately. I just keep doom scrolling. I don't know. Everything I say seems to be wrong, and nobody seems to mean what they say. It's always me that's missed the point, never anyone else. Everything feels like it's getting too much. I go to bed and stare at the ceiling for hours, and then I feel tired all day after. It just gets so hard to motivate myself when I'm like that. I keep making mistakes, and then when I try to apologise for them, people just seem to get angrier with me. Any doctor worth their salt is going to ask us a few questions now.
So, Quinn, how long have you been feeling this way? And you feel the same all day, every day? Or does it come and go? Do you drink? How much? Do you smoke? Anything else? How are things at home? How about at work?
If I tell him that most of this is down to work or college, say, then there's a chance that he may well recognise some of this could be burnout or exhaustion of some sort, but he'll still want to know more. It's not home or work especially, Doctor. It's everything. Yes, work is hard and getting harder. But it's not like I feel anybody cares anywhere else either. I do everything the way I'm told to. I follow all the rules, but things keep going wrong. I try to be nice to everyone, but people keep getting annoyed with me and I don't know what I'm doing to make them dislike me. I just feel like whatever I do, I can't keep anyone happy, and lately all I feel like doing is hiding away and crying. It's all just too complicated. I can't do it.
Quinn, I hear you. You did the right thing coming to see me. It sounds very much like depression, and we should be able to help you with that. It's your brain chemistry all messed up, making everything feel much worse than it actually is. I'll prescribe you a course of antidepressants, and we'll talk about it again in a few weeks. See if things are getting any better. Yes?
SSRIs are remarkably effective at blunting the impact of life stresses. At least for me they were. I've been on a few different ones and they all did the trick one way or another. They don't cheer me up per se, but they make life easier because I kind of care less about things, including whatever it was that pushed me to the point of needing meds in the first place. Things start to feel under control because I'm feeling less stress. And if the source of my depression or anxiety is anything other than autistic burnout, there's a good chance that the combination of reduced worry and passage of time will be enough to see me through. When I tell the doctor that everything I say seems to be wrong, that people are constantly getting annoyed with me for reasons I can't fathom, and that I can't make sense of the world anymore, he hears a troubled person describing the way he feels right now, in the moment, whilst caught up in a fog of mixed emotions. He hears things which aren't everyday complaints for most of his patients, and he interprets them as symptoms of the depression I'm seeking treatment for. The doctor knows people aren't really disagreeing with everything I say or getting annoyed with me for no reason. Nobody's treating me differently to anyone else. It just feels that way to me because of the depression. Once he's treated that, it's more than likely I'll feel better about things. But I'm autistic. People disagreeing with me before I finish my sentence or taking an instant dislike as soon as they've clapped eyes on me is my bread and butter. It can happen any time I leave the house or answer the phone. I'm not imagining that people are treating me a little differently to everyone else or being oversensitive because my serotonin levels are out of whack. People really do treat me a little differently because I'm autistic. And because I'm autistic, My sensitivities to all sorts of stimuli aren't run-of-the-mill either. And so sometimes I'm driven to distraction by things most of my doctor's patients wouldn't bat an eyelid over. I don't have just the pressures and strains of making a living in this rat race world to contend with. I have to do it through the communication barrier standing between me and almost every non-autistic person around me. There's a strain from putting on a mask, pretending to be a different someone else for everyone we meet, that frays at the edges of our sanity. A relentless pummeling from the barrage of additional autistic sensory inputs which fries our synapses. A constant confusion at the counterintuitive and emotionally contradictory behaviour we see from almost everyone we meet, and a uniquely autistic stress we feel when our routines, collections and safe, familiar touchstones are lost or cast into chaos. When the very act of existing as an autistic person in a competitive, divisive, opinionated, contradictory, self-centred, ignorant, noisy, cruel, illogical, self-sabotaging, transactional world is too much to bear, and our coping strategies collapse like a row of dominoes, we're in autistic burnout. The inexorable assault on our senses, our emotions, and our need for truth, consistency and reliability, our veracity, has gotten way too much, and we've collapsed under a slag pile of stress, disconnection and confusion. We're feeling much the same symptoms of exhaustion, emotional dysfunction, disinterest in life and lack of connection with other people as people in work burnout. But there's no boss to negotiate with. We can't hand our notice in on life and start a fresh one. If we're to change something in our lives to make sure we don't burn out again, it'll have to be something fundamental. That's what I'll be talking about next time. And then after, we'll be getting into the nitty-gritty of working out and managing those day-to-day stresses that build up into burnout if we don't act on them. But today, it's just about the BAD. Is the pain we're going through now or approaching burnout, anxiety, or depression? Are you worried about how things are going at the moment? Are you feeling like more things are going wrong in your life than are going right? Is it getting more and more difficult to see the wins in amongst the losses? Do you lie awake thinking of different outcomes and working out different strategies in the hope of getting it right next time? Do you get nervous about things you think you should be able to handle? Are you worried you might not be able to cope? Then you're anxious. You might be able to work things out without any help, but if it's starting to feel too much, it might be time to seek input from someone else. Do you feel like you've little or no control left in your life? Does it feel like you've a kind of reverse Midas touch that turns everything to ashes? Does it feel like there are 10 times, 100 times more things that need doing than you have hands and time to do them? Does the idea of talking to somebody about it all feel like a pointless waste of time? That's depression, my friend, and you need help. Ideally, see a therapist with the right training in autism and neurodivergence to be able to help you properly, but you'll have to see your doctor anyway to get referred. They can get you on the waiting list, and if they think you need medicine to get you through, I'd follow their advice. To know if it's burnout, though, we need to know what brought us here. What is it that pushed us to the point of needing help? If we can point to something specific and targetable in our lives that triggered our feelings, or a clear turning point where we can identify things went from okay to bad, then it's probably not burnout. If those anxious or depressed feelings arose after an illness, a bereavement, or a redundancy, and we didn't feel that way before, then it's quite likely those events are the root cause or a big contributor to how we're feeling now. Medication might be enough to tide us through to better times. But if in looking for that trigger, We just find ourselves going back further and further in time, each step searching for something unusual to pin it on, then it could well be burnout. If the same things have been pushing you to these kinds of feelings for as long as you can remember, then it's even more likely. For it to be autistic burnout, it has to be caused by stresses and strains we feel because we're autistic in a non-autistic world. Things that we'd be highly unlikely to experience if we weren't autistic. Being autistic means being sensitive to things many non-autistic people don't notice or aren't aware of. But the same is true the other way sometimes. Neither side experiences the world in quite the same way, so we interpret and react to some things differently. This causes conflicts, which we can find very difficult to mediate or explain because we're almost always in a minority of one, and other folks don't see things like we do. All that being said, some therapists, counsellors, and even some GPs are waking up to the truth that autistic burnout is quite real, potentially very damaging, and totally unique to autistic people. It shares symptoms and features with work-related burnout, and it frequently co-occurs alongside anxiety and depression, but it can't be solved with medication alone, and not many therapists are sufficiently up to speed to make constructive recommendations to improve things. We can't be less autistic even if we wanted to. And trying to look less autistic is often half the reason we burned out in the first place. Since help is in short supply or out of reach, we have to get creative. We have to learn how to be burnout badasses. Knowing for sure that it's burnout we're up against is the first step in the right direction. That's the BAD in badass, knowing if it's burnout, anxiety or depression. Once we can be certain this is burnout for sure, we can start being a badass, which I'll get onto next time. There's a reason I'm covering this topic right now, and why I'm putting a lot of work into it. Because I'm putting the badass system into action myself right now. Burnout is something that builds up over time, and regular viewers will know I've had a really rough couple of years. Recently I felt myself getting close to the edge and was at risk of tipping over into burnout again, so I put everything I've learned into action to protect myself. I've slowed down a bit for a start and stopped punishing myself for not meeting deadlines. But also, making these videos for you is part of my way of taking back a bit of control. Beating burnout alone is a huge victory. If I can help someone else beat it too, it makes that past pain feel a little more distant. If you like what I do and want me to keep doing it, then please think of signing up to Patreon, where you'll get an extra video every week, and I'll get to enjoy things like food and shelter whilst I make the next video. And don't forget the old like, subscribe and ring the bell routine. I'll see you midweek for the Hump Day video if you're a patron, but otherwise I'll see you soon here on YouTube for part 2 of How to Be a Burnout Badass. I'm Quinn and I'm autistic. Thank you for watching.